reporting from ASCO on regard to several abstracts that we had this year, and most of the efforts that we focused on this year is related to a drug called GC33, and this is a targeted therapy for anti-glypican-3 that will work through immune-mediated activity. We presented work in an abstract as a first-line therapy in combination with sorafenib. It was obviously a phase 1 to kind of dose escalate until we decide on a targeted dose, and at the same time obviously understand if really this would work or not. This was presented showing a questionable tolerability in regard to the combination because of some DLTs or drug-limiting toxicity that occurred. And in addition to this, the sense of it moving forward probably less likely in that regard. Nonetheless, there is a sequel to it, which hopefully we'll present at some point in time, which relates mainly to the biomarker component of it. And we have two components that relates to nuclear evaluation of the drug. Certain kind of new experiments that we brought up this time is to connect the drug to radioactive material and to do PET scans that are specific for the drug, and to understand better the localization of the drug and what effect might be. This data was not presented this time, and hopefully we will present it at some other occasions. And another one relates also to a subject that we've been working and talking about quite often, which is the evaluation of the necrosis component as part of an effect of a drug, not only the measurements as being related to the dimensional aspects of RECIST evaluation, but actually looking more deeper into the actual events that might occur related to that. And this work that we published before, but we're trying to do it in relation to GC33 specific, and we're waiting again for an opportunity to present it. The other abstract that we had, which is related to this, is actually now looking at GC33 in the second-line setting, and we had actually a quite kind of rigorous study that looked at the drug based on glypican-3 expression, and there were actually different cohorts based on how much expression of glypican-3 there was. This study unfortunately was negative as well, and it did not show any improvement in the outcome, and considering the primary endpoint or the secondary endpoints. And we like to treat phase 2 trials as being like a conglomerate of all endpoints to look at. However, there was some kind of workup that was done that definitely requires a little bit of further evaluation related to P16 and what might be associated in regard to glypican-3. Again, however, it was a little bit of more a visitation of that concept, which was not really pre-planned. If at all, this might be a consideration to move forward in that drug.